Alright, hi everybody, I'm Dr. Ejiro Isiorho from Tigard, Oregon, Corrective Supplement Health Center. You got a foot in front of me, so you know we're going to go to work. Unfortunately, this foot has had some infection going on. You can see the line of demarcation we drew on this 2 days ago, and obviously you can see the drainage is coming out. The foot is a little bit more discolored today. You can see that the redness went past that line, so we know that the infection is not under control. That's not good. We like things to be somewhat predictable, and right now it's not. So we are going to see if we can drain some of that solution out. And our patient is good and numb. And with that, we're going to see what we can get out of this bad boy. And we're going to put this.
There you go.
Relax, relax, relax.
And the TV on the ceiling.
So we know that it's numb. We know that he's sterile. Very good. This is where we actually made a prior incision, and we're just going to use that to see if we can pull more solutions out. And I think I left my
Your there.
And we're definitely going to take a swab of this and send it to the laboratory. All right, my friend, are you feeling anything at all?
What?
Exactly, I like it. So this is where we made a prior incision. And this patient unfortunately has a history of an infection. They had an infection right over here. So this might be residual infection, but they also have a history of gout. And as you can see, we're getting some fluid out, some purulent fluid. And what I'm doing is I'm milking. That's what this technique is called, when you go from far to proximal, or far to distal in this case. So we have some more fluid coming out, and we're just going to continue to milk until we can see if we can get all just that nastiness. You can start to see that discoloration, that duskiness. Now we're seeing less and less of that. Oh, I spoke too soon. You doing okay?
I'm not looking.
Okay.
It's like a pimple, right?
Almost. But I'm not taking any of this blood or fluid out right now. I'm going to take it after we actually flush him, because the skin has a lot of contamination in it. If I take some of that fluid right now, I may not get accurately what's growing out. So I'm going to wait until we're clean and flush, and we're actually going to see what is this. So right now I like the way it looks. You can see how it's depressed. It's not as inflated or like a balloon it once was. So now we start to drain it. And so what that means is we're going to pack this bad boy so it can drain. Otherwise it may reinflate. Today is Wednesday. Today is Wednesday.
Yes, it is.
Okay. See, now we're starting to get just blood again. And no discoloration, which I like. That's what it should look like inside of your foot, not the discoloration. So he's going to bruise most definitely after this procedure, but that's no worry. We just want to make sure that when he bruises, he does not break his skin down. Unfortunately, he does have underlying comorbidities, which does... I'm going to actually have you hold this for a second, please. Thank you. And this is where you flush it. When I'm flushing it, in the South we call this tea. Iced tea, but it's basically betadine and saline solution. It helps to eradicate and kill a lot of different things. And I definitely try to keep it covered because it's a squirter. Are you still doing okay?
What?
I like it. No feelings, right?
Nope. What is it?
Oh, you feel that.
No feelings? Yeah, you haven't felt it, have you? No feelings.
I haven't felt a thing, yes.
Okay, if
I
I
feel
feel it, you'll feel it. That's how it works, right?
I'll be the second to know.
You sow what you reap. You reap what you sow. How's that go?
You reap what you sow.
Oh, goes around, comes around.
Mm-hmm.
That's in Proverbs, isn't it?
It's a nice little proverb for sure. All right, so the question is always, well, how do you know how much you should go into? How much do you know? How much flushing should you do? As one attending used to always tell me, when you think you've done enough, flush some more. So we did. So now that we flush, or see if there's any other fluid coming out, and going again, we're milking from proximal to distal. See if there's anything coming out. Nothing. We'll make a new line of demarcation. And when we see this patient, love that. Look at that. Blanchable erythema. Good. Good, good, good. So now that we've played with this foot a little bit, I'm actually going to take that biopsy and that swab and see what's going on in there. Pop that cap. Thank you. Oh, that's perfect. We'll get another one. Sometimes the dropsies do happen. But fortunately, we have assistants and staff who help out and are just great at their job and help out. So when we get done with this, we're actually going to pack a little bit of packing solution. When there's a void or when there is an opening, the body wants to fill it. Let's try this again. There we go. Get in there nice and deep because we want to know what's growing, not just what's in the skin. Looks wonderful.
Ain't looking.
Now that we have that amber cleaning flavor,
Yes.
can you give me that packing solution, please?
That's okay.
Okay.
Oops.
That one was actually intentional. So you can come closer to me, please. So, just like it sounds like, we're going to pack this, and this is going to be changed daily. So tomorrow you're going to change it. And I'm going to put one entire packing strip in there, so it's good to know how much packing you're actually putting in. So when someone's taking it out, they know how many, if they need to remove 1 or 2 or 3 of these. You don't want to pack it too tight, but you don't want there to be a little bit of a void. Now that we have it packed to the point where we're happy,
I gotta do the packing.
there you go. Thank you. We'll get someone to help if you need help. We'll look out for you. Now we'll start to put the dressing on this extremity. I always like to use a non-adherent dressing, in this case Adaptic. In all my dressings, I am going to make a little bit of a slit. And that slit is so that packing strip can go in between and basically not lay on the skin. Because as you can see, this packing right now, it's laying directly on the skin. What the goal is that this is going to wick out the fluid, wick out anything that's not supposed to be inside your foot, because you have more good cells than bad cells. We just need to give your body opportunity to get rid of that infection, rather it just sit in your foot and swell up. So I make this little notch. We put that right there. And we have all these other gauzes that we made notches. I'm going to put a little bit of a compressive dressing on. We have those right there. Still doing okay up there, patient?
I'm patient. Yeah, I'm surprised. Didn't hurt near as bad as the other day. Monday.
You're going to continue with your antibiotics until we say
Well,
otherwise,
no,
okay?
yeah, till they're gone.
No, until we say otherwise. We may change it based off this swab.
You might give me more.
We might change it.
Just okay. You can do that. But I'll continue with that.
I reserve the right to change my mind. Uh,
What would you like?
can you give me one more before I fork else, please? Thank you. This is a position I would like for you to stay in more times than not, meaning more
Okay.
days you're going to be keeping your foot up and elevated. The more it hangs down.
The more I can, you know.
Mhm.
I'd really love to do it. I'm good at being lazy.
Good, good. We'll write a note
You
for
know,
your
but
wife
when
so
it
she knows.
hurts, well, if I can't do it, I ain't
Just
gonna
relax
do
your
it.
nature. So basically, we're just going to put on a mild compressive dressing. We want a little bit of compression, but not too much that we're going to strangulate his toes. He does have some blood circulation issues. I'll take, yep. And I'll
I
take a
did
piece.
tell you that I had my blood flow increased, right?
Mhm.
Angioplasty.
And that's a beautiful thing. Blood is a beautiful, necessary thing to
Don't-
heal.
don't you know, give me room to swell. in
We're going to give you room this
there.
one.
That's where I went wrong last time, right?
Well, there is
I
no, there
gotta be
is.
smarter with your bandages. You know, I gotta know when to hold them, know when to take them off.
And we'll do a little ace.
You want two?
I'll take, yep, the three.
New
Two.
one?
Yes, you get new ones.
Yeah.
Wow.
So this is where we say mild compression. So this is maximum compression. This is moderate compression. This is mild compression. We're literally just laying it down. As the foot starts to swell, as it will when it's hanging down, it will swell up and it will compress it even more. So if this dressing swells up, you have the freedom to remove or change this ACE bandage, adjust this ACE bandage. You can see we put multiple layers on, so it's not just the ACE bandage between you and the foot. You can see the toes. He has nice blood flow return in all 5 of these little piggies. I'm happy with that. We'll keep it like that. We'll follow up this patient, and hopefully with the swab, we want to write antibiotics. If we're not, we're going to write antibiotics. Hopefully we got enough of that fluid, that bad stuff out. Until the next time, Dr. Ejiro Isiorho from Corrective Step in Tigard, Oregon. Take care. Oh man, it didn't record at all.